All right, welcome back to The Link, everybody. Thursday morning, we're going to go right into the Zoom room where we were expecting Dr. Michael from One Love Pediatrics. He's also the education chair, of course, from the Physician Advisory Group. Doc, you've brought company this morning.
Yeah, this is Reef, 7 weeks old. And one of the reasons why my clinic is a little bit more limited in its hours recently. I just don't want to be working on patients and then be too tired and risk making mistakes. So,
well, congratulations, Daddy Doc, man.
Thanks. Oh, thanks. I don't know if you see in my eyes, but yeah, I think I aged another decade or so.
well, before we get into the interview and everything, how's fatherhood been for you so far? Because of course, you're a pediatrician, so you've made this your life's work, and now you're directly involved. How's the baby?
It's so fun and rewarding. All I want to do is like stay home and hang out with them. Like, so on my days off, like, you think you can get some stuff done at home, but it's like instead you're just like staring at him like all day. And yeah, I wish I could just do that, and I wish I could just take like time completely off. But with the cases rising, it's just didn't feel right to abandon my patients like that. So, right. So yeah. But overall, I mean, it's great. The one benefit of being a pediatrician, I guess, is there's a few things where I'm like, if I didn't know anything about babies, that would have been a little bit weird, and I definitely would have asked somebody. But those are the little small benefits. But parenting, it's the sleep deprivation and the constant attention. It's a different beast, right? I'm sure all parents can understand now.
Yeah. Congratulations, man.
Yeah, way to go, Doc.
Thanks, guys.
And let's just get into it then. You talked about the rising cases. What are you seeing at the clinic level?
So I'm definitely seeing more kids coming in positive, and still the fact, at least in my clinic, remains that most of the kids almost all the kids that turn positive in my clinic, they look really, really well. That being said, there is a selection bias, right? If they're feeling really sick, they're not going to come to the clinic. They're probably going to go to the hospital. But overall, the kids that I see are positive, look really, really well. The kids that look a little bit sicker actually tend to test negative, which makes me think that's probably some other virus that's going on. And almost always when I get the history, when I get a story that one of the parents, whether they got vaccinated or not, if one of the parents got sick first and then the kids got sick, I almost always say we should test, and it's almost always positive. Versus when they're like, one of my kids got sick and the other kid got sick, and then, doc, now we got it. That I haven't seen a positive case from that. Not to say it can't happen; it can of course happen, but it just hasn't been as common as not in my clinic.
And when you say kids that are testing positive, we're talking about the children that are below the age of eligibility? Is that
yeah, generally the ones there were school daycare age, and not even school age kids is what I'm seeing now. I'm pretty sure there are a couple school age, but the older kids I haven't been seeing as much, but I don't know if their symptoms have been mild enough that they haven't needed to come in or their parents weren't suspecting it. But the ones I've been seeing positive have been on the younger side for sure.
Do you know anything about the pediatric admission over at the hospital?
We I just got off the peds department meeting, and I wasn't involved in their care, but I heard that there are 2 confirmed cases of MISC. I don't know much besides that. It seems like they're doing pretty okay, and the age range is around like 10-ish. So I don't know much more about that. MISC, as you know, is something that's kind of come up a little bit more in the news now that more and more kids are getting infected with COVID. We first, scientists or doctors in the UK first noticed this back in April 2020. And it seemed to be like a really rare thing that looked a lot like another condition called Kawasaki's disease. And Kawasaki's disease, we think, can have a viral trigger. And there's a lot of overlap with how Kawasaki's and MISC present, meaning they'll have like some high fevers. Kawasaki's disease we want for like 5 days or longer, but MISC could be 3 days or even 1 day. And then there's like multiple organ involvement. So you can have lip swelling, pink eye. One thing with MISC that we're seeing is that kids are having vomiting, diarrhea, or abdominal pain, which we tend not to see as much with Kawasaki. And then scary part is, it can cause low blood pressures and decrease perfusion to the organs. So, it can affect the heart, it can affect the kidneys, it can affect the lungs. There is a treatment for it, but I've heard that because cases in MISC and probably other things are rising overall across the country, IVIG, which is the treatment for it, is on very, very short supply. And I think, that's obviously very concerning. Let's see what else. The incidence rate for it in different studies, I've read one that was based out of the East Coast. There's another one, I think, based out of Texas. Seems to say about 320-ish cases per million COVID children cases, right? So if you scale that down to our population, we have about 40,000 kids, 14 and under. So that'll come out to about, 10 to 12 if every single kid had, caught COVID. Obviously, we're not thinking every single kid is going to catch COVID. So my guess is we're going to have at least a handful, although it's very possible that the initial incidence rate was underreported, as people, weren't really sure what they were looking for. There's been a public health advisory that's been put out. The pediatricians, we talked about it just in our department, but one thing, if any family medicine doctors are listening that are seeing kids, is to just have a really high suspicion. One of the pediatric hospitals said one child came in and then looked pretty okay, and then another kid, they came in about 10 days after symptoms started, and they looked much sicker. Although both apparently are still doing okay right now. And typical age range is going to be about 8 years old, from what I've been looking in the literature. And it seems to happen about 4 weeks after a COVID infection. There's some very pretty strict criteria. One does have to be that they do have a history of a positive COVID test. There can be no other plausible explanation. So, if they have like other things that might have caused it, then that's, you probably can't call it MISC, even if COVID might have played a role into it. We're seeing that compared to Kawasaki's, the age range is a little bit higher. Although when you look at the broad range of it, younger kids under 5 seem to be a little bit more susceptible to it. Although the mortality rate seems to be about 2%, and that seems to be more skewed toward the older kids, like 17 and up. And I haven't really looked into the MIS-A, which is for adults, multisystem inflammatory syndrome for adults, but that seems to be an area of study that people are starting to look into. So you guys might hear more about that from another physician.
Doc, you said that the shortage and backup of treatments for this condition is alarming. So how concerned should we be about being able to respond to this now that public health has put out this advisory?
Yeah, so I've been hearing that the hospitals, hospital in Guam with Navy and JRMC, they share resources. So it looks like they've been able to secure some doses, I think maybe from another hospital. But there's supposed to be shipments that are coming in, and shipments are mostly, what I'm understanding is more of a logistic side, not from our end, but they're either having delays, and because we're so far out and this stuff is temperature sensitive, that sometimes you can have things arrive and then not good anymore because it's too hot, it's out of temperature range. So that's been some problems. I mean, I've definitely had that same issue with vaccines that arrived at the clinic too warm, and I had to send them back. So I imagine that's happening, to everyone, including GMH and JRMC and Navy. So for now, the thing is, there are ways we treat Kawasaki's disease. For MISC, there's still not a proven method of treatment. So it's kind of like, well, we think this should work, and so we're doing it, and it seems to be like what was in the literature, it is working. But there probably more than one. There might be more than one way to treat it, and because the kids are, from what I hear, the kids are doing okay right now. It looks like maybe for now those kids should be fine, but it's definitely something we want to take care of in terms of our supply of medication and treatments that we can have on hand in the island.
Is there any way to prevent MISC?
The only true way to prevent it is to not get COVID, right? Because that's going to be one of the criteria for it. It's unclear, although it seems reasonable that if you're vaccinated, you should have a lesser, better response against COVID. And so maybe you shouldn't be, but there's not, because kids have been starting to get vaccinated so recently. It's probably going to be a while before we get that data out, but that seems reasonable. And let's see what else. Yeah, I mean, the biggest thing is, you have to try to prevent the kids getting COVID. It's scary because of the breakthrough infections. Vaccinated adults, can bring it home and they might feel okay, but, the kids, like I said, initially they'll look okay, but it's going to be like the 2 to 4 week period afterwards that you kind of have to keep an eye on. But again, it's relatively rare. So that's the one thing we have in our favor.
Doc, I know that we've talked about this, I want to say a couple times during the course of the pandemic as you've come on the show, but I want to say you treated a pediatric patient with this condition last year, right?
It's technically, so I thought it would have been. Technically, it wouldn't have that criteria because there was another very plausible reason for that kid's condition. So ultimately, I feel COVID made it worse, but and maybe he did have a lot of similar things, but it wouldn't have met strict criteria for it because he did have a pretty significant underlying condition. But yeah, good memory.
Thank you. Yeah.
All right.
I think we're gonna let you go because you got to burp the baby.
Yeah. I think so.
Like, Dad, come on.
Yeah, so basically, Dr. now has 3 roles, right? He's the education committee liaison on the physician advisor group. Of course, he runs his own pediatrician clinic, and now he also runs daddy daycare.
Yeah.
Yeah, pretty much. But seems to be mostly a diaper service.
Yeah.
Well, thanks,
Yeah,
Doc.
Doc. I mean,
Bye,
just
Reeve.
before we let
guys.
you go, just real quick. I mean, parents take this advisory seriously and also look out for these things at the home level too, Doc. 'Cause I know it's a physician's advisory, but
Yeah, it's a physician advisory, but the thing with MISC is generally, it's not something that's going to be very subtle, right? There's going to be something going on with your kid where you're going to be like, oh, you know what? I think I'm going to at least take him into the doctor. What I've been seeing in the literature is that they tend to come in looking pretty severely ill. And so, it isn't like, they felt a little bit warm today and there was a little gas, maybe I'll take it. It's like, oh no, they're going to look a little bit more sick that you got to decide like, oh, are we going to take in a clinic or to the hospital? So it's not something I want to unnecessarily alarm parents about, but just be aware, especially if your kid had COVID 2 to 4 weeks ago, and then you're like, oh, now they seem to be getting sick again, and we can't really find a reason. That being said, there's still a lot of viruses out there, and we're seeing kids come in with all sorts of things. And it could be mild colds. We're in bronchiolitis season, and still see a stomach bug here and there that have nothing to do with COVID. So, there's, clinics are open, and doctors should be starting to be a little bit more vigilant about this. And again, we're going to make sure we can try to identify them early and get them the attention and care that they need.
Right on.
thank you, Doc.
Thanks, Doc.
All right, guys.
All right.
Hey, congrats
Take
again.
care.
Okay.
Let us know if you need a sitter. Bree's totally
Thank you.
available.
All right. Thanks so much, guys.
All right, take care.
I see Bree just like eyeing the baby.
Oh, yeah, I would.
Bree was
I
laughing
would.
through that whole interview. I mean,
Yeah.
obviously a very serious
cutie.
topic,
Yeah,
but
yeah.
and normally background noise and everything like that, we'll try and control it. But that's awesome.
Yeah. Let me tell you, I got the
Thanks, Doc.
hold though. All my kids, I got that hold down. That hold them.
He's a pro. You
Hold
need
him like
any tips,
Yeah,
advice?
I'll send you some videos, Doc.
Oh, great.
Hey, it's 9:20 Thursday, October 14th. Okay, let's. You guys hungry? Man, I am so hungry, guys. Oh my God. We'll see you, Doctor. Thank you so much for your time. B. Morales comments in here. I remember that fight with Manny Chong and Steve Roberto. The crowd was throwing bottles into the ring, and Chris being upset at them. Yeah, that was the first time I actually got like.